I'm Dr. Tony Frasca. I'm an attending here at Blue Ridge, and I've been here at Blue Ridge for close on 2 years. I trained in psychiatry at Wake Forest, and Wake Forest used to send residents to train over at Broughton, the state hospital down the road. And I fell in love with Broughton and the patients there and the staff there, and came to like Morganton really well. And as fate would have it, there were job opportunities here and personal opportunities here, and I knew this was a place I would like to live. Starting in June of last year, we opened up a 14-bed medical detox program for people who have dependency issues on alcohol or opiates, narcotics, primarily, although we do some other stuff, but those are the two main people we treat. And of course, those are two large and growing problems in this area. Alcoholism is the #1 substance abuse problem in the nation. It causes untold chaos and harm to people both directly and indirectly. People are hard pressed in this area to find a reliable place to safely come off it. Of course, the epidemic of narcotic abuse keeps growing, and that could be a long conversation. But even there, pretty few and far between places that will take people in and treat them humanely and treat them quickly and try to get them back on the right path. And so we felt we were seeing a lot of that on the behavioral health unit already. And so we felt like that was definitely a need the community had, and Blue Ridge responded to that. A lot of people who've been either alcohol dependent or narcotic dependent have tried to quit on their own, okay? And when I meet them, what I usually tell them, if they have or they haven't quit, is that quitting's kind of like jumping off a cliff. You can jump off a cliff with a parachute or without a parachute, okay? If you go off the cliff without a parachute, you're going to break some bones and you're going to make a big hole in the ground. If you go off the cliff with a parachute, I can't promise you're not going to twist an ankle or break a leg, okay? But you're not going to make a big hole in the ground, okay? And you're going to live through it. And that's what we aim for. We can't promise to make people perfectly comfortable, but we know of places where people are basically, given just very few medicines and kind of left all but on their own to get through. And we know of even more people who actually quit on their own. And people can die in those circumstances. And if you don't die, you feel pretty miserable during it. And we think that's an impediment to people doing what they want to do, which is getting well and staying well. Well, in practical terms, people tend to come to us when the bottom's fallen out, when they've lost someone they've loved because of their dependency, when they've lost the job they needed to take care of people they loved, when they've put their own life or the life of loved ones at risk, okay? Or when they're just flat out of luck, when they've just burnt all the bridges with people who did love them and still love them, but just can't support them in that habit again. They basically, come in when the bottom's falling out and there's not many options left. The criteria for being dependent are pretty cut and dried in the book we use, the DSM. And in plain speaking, it's if the use of the drug has taken on a life of its own, if it's devoured your life, if it's squeezed out all the things that used to make you the man or the woman you used to be, and you're spending most of your days chasing after it to feel good or to avoid feeling bad, you need to take a step back and realize that you're no longer in control of the substance, it's in control of you. And that's probably a time to think about maybe what you could do different. In some ways it's simpler, in some ways it's not. It's simpler on the detox side because we're there for one purpose. We're gonna help you get through the withdrawal, okay? And then we're gonna hand you off to somebody else. But in a larger sense, especially what we see on the psych side and what comes after being detoxed, is most people don't sign up for being dependent on anything, whether it be a person or a drug, okay? Most people end up being dependent on a bottle or on a pill bottle, okay? Or on a line of cocaine or on whatever they're using, okay? End up in that situation to compensate for any one or any number of things that are going on in their lives, okay? Things they're trying to avoid, things they can't cope with, things that are overwhelming to them. So the biggest issue in terms of the complication is, first, for those people, we got to get past the withdrawal, and people aren't in good spirits or really in good form to address those deeper issues when they're feeling miserable like that. And secondly, once you get them past that, people's willingness to address those issues varies pretty widely. If those issues were easy to address in the first place, people wouldn't need me. They wouldn't be coming in with that kind of a problem. Yeah, very much so, very much so. I think, again, from a philosophical point of view, it's just a matter of degree, okay? It's just a shade of gray. Absolutely. There are people who treat food the same way some people treat narcotics, the same way some people treat alcohol. For some people, food is a comfort. For some people, self-abuse, the cuttings and the burnings they do to themselves is a compensating mechanism. Absolutely, there's great similarities to it, and it's not sacrilegious to refer to them as such, or to consider them in the same vein, because they come from the same root, which is dissatisfaction with how things are going in your life, a discomfort with yourself as a person, and a wanting to feel better, to not be anxious, to not be depressed, to not be angry, to just feel better about yourself. Holistic means exactly what you touched on, which is, not just a purely biological model, not just a purely psychological model, not just a purely spiritual model, but a combination of all the above, because people are a combination of all the above. Okay, we're made from the stuff of the earth, which is the biology and chemicals that are all around us. Okay, that can be manipulated and changed by the things we put in our body, both to the good and to the bad. The reason we do those things, okay, has quite a bit to do with how we were raised, where we were raised, what we were raised to believe, and how we feel about ourselves and the world around us. And those things, how we feel about things and the way we were raised and our beliefs about things and what we put into our bodies as a consequence, have profound immediate effects on our psychology and how we look at the world, both while intoxicated and while not being intoxicated. As well as the underlying reasons why we do those things in the first place. But that's the beauty of it, which is it all ties together. And so, up on the fourth floor, not everybody gets equal measures of all of those pieces, okay? But no one goes without some of those pieces, and we account for all those pieces. Again, in detox, our purpose is to take care of the biological first and foremost. That's our reason for being up there. But we try to lay the groundwork, and in almost all cases, we do lay the groundwork for what comes next, which I alluded to before, which is once you get past the effects of the chemical, or the effects of the absence of the chemical, what you have is the reason you started the chemical in the first place. And that takes you back to square one, back to the beginning.